Cameron McClintock, and today I wanted to talk about examining the relationship between campus culture and alcohol abuse among college students at Rutgers University. For question one, I wanted to highlight Kenneth Kopp, the Executive Director and Chief of Police at Rutgers University Police Department. He's an alumni of Rutgers and has completed a lot of additional training, such as the FBI National Academy and the West Point Command and Leadership School. He is an active alumni of the university that he foresees the safety of, making him an efficient and knowledgeable asset to the Rutgers University campus culture and behavior of the students. I also wanted to highlight Dr. Margaret Swarbeck, the Associate Director at the Center of Alcohol and Substance Use Studies and a research professor at the Graduate School of Applied and Professional Psychology. She has published several articles discussing the importance of community behavioral healthcare practice, which is applicable for the unique community situations with the students at Rutgers. For number two, I wanted to highlight that New Brunswick is an urban city with various corporate headquarters, including Johnson & Johnson, and healthcare systems such as the Robert Wood Johnson Hospital. It has over 50,000 residents among the large number of students and employees within the city. The median household income is $57,138, significantly below the New Jersey average household income at $99,781. The area surrounding Rutgers University is moderately impoverished, with about 31.9% reported as such. I also wanted to highlight the Rutgers University Police Department, which works with the New Brunswick Police Department to police university grounds and the surrounding neighborhoods. There are over 300 officers, and they're all fully certified by the New Jersey Police Training Commission, and they're responsible for maintaining safety on campus. For number three, colleges create a unique environment where alcohol is ingrained in social situations and culture. There is also a unique environment where there's less supervision and less structured schedule that can foster unhealthy behaviors. Additionally, there are businesses that provide alcohol, such as liquor stores or bars right outside of campus where many students live, that makes alcohol more accessible. College students may struggle with portion sizes and consuming alcohol safely. There's also a concern about binge drinking, which is 4 to 5 drinks within 2 hours, which can lead to a quick high blood alcohol level. Additionally, problems with alcohol can be more detrimental, as drinking can result in academic struggles, missing work or school, and is more likely perceived as normal when compared to other age groups, as it is ingrained in the social culture. Finally, there is a higher likelihood that alcohol consumption on campus can result in significant problems, such as police charges, sexual assault, drunk driving accidents, or damage to self and others. For number four, one of the top researchers regarding college students and alcohol abuse is the National Institute on Alcohol and Alcoholism, which is a program for the United States government. The overall mission for the NIAAA is to create crucial knowledge about the impacts of alcohol on health and well-being, and to utilize that knowledge in order to improve diagnosis, prevention, and treatment of problems related to alcohol. They conduct and support alcohol research, such as the impact of alcohol on the brain, utilizing neuroscience. For number five, I wanted to make it clear that NIAAA is funded by the United States government, as it's a part of the National Institutes of Health. For number six, as a current upperclassman college student, I can reflect on my past choices and utilize them as motivation for my project. I was once a freshman and was consumed by going out on the weekends, which resulted in failing a class, feeling incredibly unhealthy, and just not feeling like myself. I also made some decisions during that time that, now looking back, were incredibly unsafe. This intervention would have deterred me from making the choices I did at that time. By creating constant education and information that's readily available, I think it'll help students understand more of what they're putting their bodies through and what they're putting themselves through when they decide whether or not to drink or to drink safely. For number seven, this intervention will positively impact the community by education. It will inform the at-risk population of the effects of excessive alcohol consumption and how to be safe when consuming alcohol. Additionally, it can eliminate a risk for local businesses, as it'll keep them accountable and ensure that they're not serving anyone underage. Finally, it will allow police and emergency responders to respond to genuine emergencies in the community. If they're occupied shutting down a party, they're unavailable to provide aid to more critical emergencies. For number eight, research suggests that trusted adults inform their children of the dangers of alcohol as they enter adulthood. I'm suggesting that we ensure they get that information. It shouldn't be a one and done conversation. It should evolve and grow as students become of legal age and how to drink alcohol safely while mitigating possible issues. Number 9, I would market the intervention to the local police and Rutgers University overall. It's not so much of a I need students to buy into it because in an ideal world, it's mandatory per semester. I need Rutgers to want it because they have a really big stake in the intervention as it'll help lessen the liability they have. They get really poor press each time a drunk driving accident is put in the newspaper, which makes it difficult for parents to want to send their kids to gain their higher education here. I'm suggesting that the university should ensure that they're ensuring that they're doing their part in making sure their students are successful. Number 10. I think surveys of the student body would be the most useful approach. I would conduct a preliminary survey prior to the implementation of the intervention to determine the rates at which each class of students are consuming alcohol. I would also include questions about general well-being and health. After implementing the course, I would send another survey, ideally about a month into the fall semester, to gauge how students are responding to the course and if their alcohol consumption has changed. I would also ideally select about 200 students at random to do more frequent monitorings and surveys and to track their grades in relation to their alcohol consumption. Number 11, I would argue that the college culture is a large contributor to the upstream. I think that the fact that a large part of the culture is to consume alcohol socially is a large impact as to why so many students feel that they have to drink to be social and make friends. Number 12, there's not something I would so much as change as much as I wish I could have started it earlier. I would ideally take a random group of students selected in the beginning of their freshman year, and then this intervention would occur the following year. I feel it would be helpful in my research to determine their alcohol patterns earlier on, in addition to their immediate academics and their overall health. And then I would be able to see how the intervention was performing with them, having like a longer case study. Number 13. I feel I'm an expert in the community, having lived off and on campus in the surrounding neighborhoods for the last 3 years. I am also involved in organizations and a nursing major, which has given me a very good sense of what attending Rutgers is like and how it has impacted me. I don't feel an expert in the overall health issue because it's a very widespread issue, and there just isn't as much research focused on college students as there is on adults between 25 and 40. Number 14. My role was executed by identifying a specific problem that impacts my community as a whole. I set out to find a solution to help alleviate how commonly alcohol impacts college students, which is a direct impact on my community and the culture surrounding my university and my peers. Number 15. I would personally use it as education for my friends and family. I have a younger sister who just started her freshman year at the University of Buffalo as a pharmacy major, and I would love to give her some of this information to ensure that she's staying safe in whatever she chooses to do. And then I also have some younger family members and family friends that are in high school still, and I'd like to give them this information before they start college, just so that they know how to start out on the right foot. Thank you.